Hi, I'm Chris Van Hollen, and proud to represent the great state of Maryland in the United States Senate. I was pleased to participate in the very first Hopkins on the Hill event in the Senate's Kennedy Caucus Room back in 2017. And while I wish we could gather again in person, I'm delighted to join you this year for Hopkins on the Hill at home. Johns Hopkins is one of our state's great treasures. You were established as the nation's first research university and have remained at the forefront of our national research efforts ever since. Hopkins combines a first-rate education for all who come through its halls with top-of-the-line research in a wide variety of fields, from space to global health. Your endeavors keep our state and our country on the cutting edge of new discoveries. Johns Hopkins continues to be a national leader in university R&D expenditures, with nearly $2.5 billion of funding from federal sources in 2019, including from the National Science Foundation, NASA, and the NIH. In fact, Johns Hopkins has been the top recipient of NIH research funds year after year, and your national leadership on all aspects of our response to COVID-19 shows why that remains the case. It's one of my chief priorities in Congress to secure federal funds for Hopkins and other Maryland universities to support programs important to the success of our state and our country. I'm glad that we've been able to deliver additional emergency relief for our federal research agencies and to Johns Hopkins throughout this pandemic by passing a suite of COVID-19 relief measures. And I've been honored to join forces with Johns Hopkins throughout my time in public service to develop ways to address the pressing issues facing our community and country. And I look forward to continuing that partnership in the future. So thank you. Thank you to the entire Johns Hopkins family for all that you do for our state and our country.
Welcome.
Welcome to Hopkins on the Hill.
Welcome to Hopkins on the Hill at home.
The emergence of the jingle dress began with a dream of healing and strength. It continues to be seen as a healing dress today and a source of pride for many Indigenous peoples.
OCO, Victoria Okeefe Dawado. Hello, my name is Victoria Okeefe. I'm a member of the Cherokee and Seminole Nations of Oklahoma. I'm an assistant professor at the Johns Hopkins Bloomberg School of Public Health and Center for American Indian Health. My research focuses on strengths and culturally based mental health promotion and suicide prevention with Indigenous communities. For many Native communities, our youth are considered sacred and our future community leaders. That's why we must address the pressing issue that suicide rates among Native youth in the United States are higher than all other youth. Native communities are developing community-based solutions to suicide prevention that the whole world can learn from. The White Mountain Apache tribe developed a community-based suicide surveillance system and case management system. And their public health approach has led to decreased suicide attempts and deaths across the community. One part of this approach is a youth school-based program developed from the ground up within the community. It's called the Elders Resilience Curriculum. Each month, elders go to local schools and teach lessons to youth ages 11 to 14. All of the topics focus on Apache cultural values, traditions, and teachings about various areas of life.
A lot of our kids are disconnected with our culture and our language, and our elders are bringing that back for our children.
We told them you have to respect yourself, respect the elders, respect your family, the leaders.
The Johns Hopkins Center for American Indian Health has been involved in helping with the COVID-19 response with Native communities. One project that I helped co-lead is a storybook for Indigenous children and families called Our Smallest Warriors, Our Strongest Medicine, Overcoming COVID-19. This storybook weaves together public health, mental health coping strategies, and shared cultural teachings across tribes into a strengths-based book. We've sent more than 42,000 copies of this book to Indigenous children and families. Because the development of this book brought us so much joy and we had such a high demand, we're actually launching a sequel in the coming months.
Bonjour, hello. My name is Melissa Walls. I'm Bois Forte and Couchiching First Nation Ojibwe, an associate professor at Johns Hopkins, and I work in collaboration with tribal communities to address health inequities and celebrate our stories of strength. I serve as the principal investigator for the Healing Pathways Project, which started in 2002 as a way to address community-driven questions about American Indian and First Nations health. Healing Pathways is an alliance between tribal communities and researchers at Johns Hopkins. We are equal partners in a process that emphasizes turning research into action and addressing community health priorities with locally relevant data. The Healing Pathways Project includes survey data from hundreds of Indigenous participants in 8 separate communities in the US and Canada. The project is the only of its kind in the world to follow Native participants over a span of nearly 20 years, providing a wealth of critical information about healthy development. Our team has developed novel measures of discrimination and historical trauma, including an assessment of historical cultural losses. We've adapted measures of strengths as well. We've found that Indigenous community members report very high levels of benevolent childhood experiences. These are positive early life factors that promote well-being into adulthood and offer a source of resilience in the face of stress. The outcomes of Healing Pathways include ground-up solutions and programs to promote mental health, reduce early substance use, increase community and family connections, and celebrate the many sources of strength within Native communities.
Welcome to Hopkins on the Hill. A special thanks to the Senator for Maryland, Chris Van Hollen, for his message. So today we speak with Drs. Victoria Okeefe and Melissa Walls with the Johns Hopkins Center for American Indian Health. Dr. Okeefe's research focuses on reducing suicide in Native youth in the United States with interventions that are developed and delivered by the community. She has also supported the COVID-19 response in Native communities. Dr. Wall's research is really putting the focus on Native communities' health priorities, keeping that at the center of the research, and following people for up to 20 years. We'll take questions from the audience, as we always do. It'll happen at the end of our discussion. So if you have a question, please pop it into the platform below. So Victoria and Melissa, thanks for being with us today.
Thanks for having me.
Yes, I'm happy to be here.
So Melissa, I'd like to start with you. The Healing Pathways program is one you describe as a process to address the health priorities of 8 Native communities. So what makes this research program a process?
Yeah, good question. I think, all research is a process, but the word process is used really specifically here to refer to a thing called community-based or tribally based participatory research methods. So the acronym people use is CBPR. And I think in the past 10 years or so, this method or orientation to research that tries to equalize power imbalances between the researchers and the people who historically were researched and really create true authentic partnerships is what we mean by that. And in our case, the origins of the Healing Pathways Project, the study that I talked about in the video, came from community concerns. So some of our tribal members were mentioning, a lot of our kids are being overdiagnosed, we think, with ADHD, and they're being given medications to treat this condition. And we wondered, are they really, meeting criteria for ADHD? And some researchers at the time said, we could measure that, we could figure that out. So origins of the project from community. And moving forward, the data we collect is decided by our community research teams. They're called community research councils, and every single year the priorities might shift as community needs change. And then further down the road of the process, the outcomes of the research, we really believe need to serve communities first. So if the data is coming from a community, that's where the data needs to get back first and most quickly. So this might include things like community-specific reports or presentations to tribal leaders, or we're really working to innovate and outreach using social media and YouTube, trying to create these YouTube videos and just getting results out there and into the hands of local leaders and people in tribal communities who are writing grants.
So you noted in there that some of the research focuses on this positive early life experience. That's what you said in the video. And how that influence on children, these positive experiences, have an impact on resilience later in life for these individuals. Can you tell me a little bit more about how you do this measurement of positive childhood experiences?
Yeah, I can give you, I think, one concrete example that I think I mentioned, which is BCEs. So first off, we hear so much, and I think even the general public hears about this thing called ACEs, or adverse childhood experiences, and rightfully so. I mean, ACEs are shown to really have an impact on us. The stressors and the traumas of our childhood can have a lasting impact on our adult lives. And I was at this conference in Colorado, and I happened to hear a researcher named Angela Narayan present on this topic. She was talking about angels in the nursery. What a beautiful thing. And she brought up these BCEs, benevolent or positive childhood experiences. So I contacted her and I said, listen, we'd love to try to measure these types of things within tribal communities. And we used her work as a model for assessing positive influences in tribal contexts. And our community research team really worked together to adapt the measure for local tribal, contextual, cultural context that made sense. And then we created this, what ended up being an 8-item measure, where we asked people things like, when you were a kid, did you have a caregiver that you felt safe with? Did you have a teacher in your life who you felt like cared about you? Did you have good neighbors? So just basic positive early life experiences. And we found that 83% or so of the people in our study, all Indigenous people, American Indian and First Nations people, reported experiencing at least 7 of these 8 positive childhood experiences, and these predicted positive outcomes in adulthood. And, it's worth noting, we also measure ACEs, which are also disproportionately high in our communities, unfortunately, but we had been totally missing this opportunity to celebrate and assess and recognize these strengths until we started thinking about the counterpart of ACEs, or the flip side of ACEs, which is BCEs.
So you, in this kind of recap of what you just said, you saw it at a conference, this measurement, this BCE, this positive childhood experience. And then do you take that back to the community and say, is this of interest? Because if the community is working to translate it to make it totally applicable to their community and their context, obviously they bought in. So is that a part of this process that you talk about in the Healing Pathways, that it's a research process?
Absolutely. So, the seemingly simple thing of constructing a survey is actually super complex in any condition, but especially when we're trying to really do equitable, collaborative, co-creative research. So 2 things tend to happen. One is, I might come up with ideas because I have the privilege of getting to go to conferences as part of my job and learning from other scholars. But community teams have, oh my gosh, such innovative ideas about how to measure, for example, cultural strengths that have nothing to do with something I read, but everything to do with traditional ecological or traditional knowledge that has been passed down by our elders. So we try to measure any of these things. And the trick is then, of course, ensuring that they're reliable assessments. Do they operate okay when it comes to analyzing the data? Do they have good psychometric properties? And we work on all that stuff, but really the heart of what are we going to measure is a super collaborative, but ultimately community-driven thing. If there's an item that I hear about at a conference that sounds like a cool thing to measure, but has no relevance in local context, we wouldn't put it in a survey.
Gotcha. So then you measure these things and you link them to this outcome you noted of resilience. Mm-hmm. What is resilience?
Right. Well, on the one hand, we've got things like these BCEs or cultural strengths, as I mentioned. These are just inherent strengths. And there are many of these in all communities, and especially, I would say, in Native communities. We just need to measure them. But we can also think about, buffering factors. So if I encounter stress, what are some of the protective or stress buffering things that might promote my wellness or my well-being, even in the face of hard times? And I would say that the top two variables that really drive that kind of resilience in Native communities are culture and a sense of community and connectiveness. And I think this line of research, one that focuses on strengths and resilience, strengths-based approaches, often it's called, is super important for everyone, but especially in communities where we tend to be marginalized. So I think there's two important points I want to make. One is, when we do this kind of research, we can generate empirically supported targets. So research-supported targets for improving health through strengths-based public health programming, for example, or prevention programming. And then two, we help to shift the narrative about who we are. So our communities, tribal communities, have been stigmatized for centuries. There's this victimry narrative, sometimes like, so much colonization and the legacy of historical trauma has got us down. And it's certainly true. We have endured a legacy of these systems of oppression, but we persist. And this strengths-based research, oh my gosh, it's so, as a Native person, very uplifting to get to be a part of it. And it helps to represent what I see my family as, and it balances this public narrative.
So then tell me about how you measure these things in early childhood and then relate them through this strengths-based approach to resiliency and kind of the things that we need when things are harder in life. I mean, you obviously need people to span that time to observe them as a child and then as an adult. And you noted these 20-year studies. Can you get a little technical here and talk to us about exactly how you do that?
Sure. Yeah. I mean, I am so fortunate to be a part of a team that started in the late 90s, collecting data with Native communities. At the time, adolescents who enrolled in the study were about 10 years old. As I sit here with you today, Carrie, they're probably 30, 31 years old. And so we've been collecting data from the same cohort. We call it, it's a longitudinal panel study, and really following their development over time and assessing their health outcomes, mental health outcomes, and then all of these risk and protective factors. We've been talking about the protective factors, but we measure both. And so with these 20 years of data, you can do so much. So we can account for, factors in our analyses that might address issues of potential confounding, for example, or we know that in life there's multiple influences on our health, and we can account for those because the data is so rich. So as an example of this, with that BCE construct, that measure I told you about, we found, as I mentioned, that positive childhood experiences are associated with early adult well-being. And we can see that this persists, this relationship, even when we account for negative things like ACEs or stressors in adulthood. And so having this longitudinal data that allows us to account for all sorts of impactful things across the life course is super powerful. And we also really need to prioritize, we think, validity. So, in measurement, in science, we worry about reliability or consistency and validity. Is the measure tapping what we really think it's tapping? And so for us, validity is an important metric of community salience. Does this measure mean what it's supposed to mean in this context? And so this community team I keep mentioning, our Community Research Council members, do hours and hours of rigorous reviews of measures. We assess comprehension, contextual fit, And we pilot everything. If something lacks validity, we work really hard to revise, pilot, and then validate it within our sample. So, what sounds really nice, like collaborative co-creation of measures, is really a long-term process of trying to create indicators that then hopefully other researchers across contexts can try to pick up, use, and adapt if they need to.
Well, and you have this other, issue too, that time changes, right? And when you follow people over time and kind of what I always talk about, like pushing on your data, right? And that is that kind of constant check of validity and constant check to reliability to make sure that even as things change over time and the world around us changes over time, our measures are still the same, but you can only get those measures if your people keep coming back. So, I think about these 10-year-olds 20 years ago who, probably were enrolled because their parents said, come on, we're going to do the study. And, 20 years later, they're 30-year-olds. They probably have kids of their own or, jobs, a life that they've created. What makes them come back to your research studies? How do you keep people coming back for 20 years to participate in your research?
We asked our participants that in the most recent waves of data collection. We've asked them two things. One is, how's this going for you? You've been asking these types of questions for years and years. How does it feel to be a participant, and why are you here? And then secondly, what impact has it had on you? We also ask things like, what else do you want us to assess, which is another topic. But in terms of retention, yeah, it's a huge deal in any study, but one that spans decades, it's a huge concern. So we've managed over this 20-year span to retain a little over 80% of the original target adolescents from the study, which is, I think, really commendable. And all 100% because of community relationships and the fact that the people collecting the data are tribal members living in their communities, incredibly professional, incredibly supportive, incredibly committed to this project. The most amazing work ethic, going through snowstorms. We actually have a story of an interviewer who had a black bear crawl into his van in the middle of an interview with a participant. So these guys they're committed. But the other piece is the participants themselves, and I credit our community team for this as well. The participants understand the value and the meaning of the study. So when we asked them, why are you staying in? How's this going? What's this like for you? They tell us, I've been shown that this kind of research can benefit my community by informing programs, by helping the tribe to get grants, whatever it may be. And I feel like I have a small part in making that community change. So I think this very deep cultural value, that's, I think, true of all indigenous communities, but certainly for Ojibwe communities, this idea that I do what I do to give back to my community is part of why they participate. And so it's this sense of I'm doing something. It's a sense of service and a sense of celebration. And, we're working on a manuscript now just to share with the scientific community those open-ended answers from participants, because I think it's, so we have so much to learn in all of science from what they've shared with us.
That's amazing. So that is an amazing accomplishment, 20 years to really keep people engaged and involved and to cultivate that sense of servicing community. Melissa, why do you do this? We just heard why your participants are engaged, but why do you do the work that you do?
I do it for the same reason they do, Carrie. I, on a very personal level, I was recruited to go to graduate school because my family was involved with this study early on in terms of helping to shape kind of the direction of it as community members. They had a role in it. And I was fortunate that the research team at the time who was heading the project was willing to invest in Ojibwe students to help us train up and learn how to do this kind of science. And with my family's support, I went and got a PhD. And so this thing that was a study I trained with and the community team were my mentors. I now serve as the PI, but we are certainly, we're all co-PIs, I think, in this project. And the entire reason for that is I can see the impact that science can have. It's one tool in the toolbox, right? But it's a powerful tool in our world to be able to shift policies, or to be able to say, I have some evidence here that this works to promote health, and that that other piece of the story, that I can shift narratives because of the platform of being a scientist, that gives you a space to be able to do it. So it's all about giving back. It's all about doing good. It's all about improving health. And ultimately, the North Star is health equity. It feels out of reach in my lifetime, but who knows? But baby steps to get there.
And, health equity as the North Star, that is an amazing perspective, right? Because you have to have a North Star. You have to keep going. Sometimes this work, I imagine, can be really daunting, right? Research is hard. Good, rigorous science is hard. Victoria, I'd like to bring in your research, because really this is in the same vein and towards that North Star of health equity. The program that you work with focuses on interventions to improve mental health and wellness that are really culturally grounded, developed, and delivered by Native communities. And you noted the suicide surveillance system and the case management system, that both systems developed by the White Mountain Apache tribe. Can you describe these systems for us?
Absolutely. And I'll just start by saying it's such an honor and privilege to work with the White Mountain Apache community. They've been doing this work really for decades. So I'm coming in as really a newbie and learning so much from them, just as Melissa said, constantly learning from our partners on this research. But suicide was prioritized by the White Mountain Apache tribe after the community began to see spikes in youth suicide in the 1980s and 1990s. And the tribe had already had a relationship with our Center for American Indian Health through our founding director, Dr. Matu Santosham, who had been doing more than 10 years of infectious disease prevention work with the tribe. And over time, because Matu had developed that amazing trusting partnership, the tribe came to our center when other priority issues came up. So one of those was suicide. And they said that this was an issue and a priority that they wanted to address together. So the tribe established a community-based suicide surveillance and case management system that they call Celebrating Life. The system was established by a 2001 tribal resolution, which mandates anyone on the reservation to report suicide and self-harm behaviors to a centralized registry system. And this system is managed by an amazing team of White Mountain Apache tribe community mental health specialists who are called the Celebrating Life team, and they follow up on every single report. The Celebrating Life team members are trained to provide case management and support through wellness visits if the person would like that. They also connect individuals to local mental health resources. They can also connect folks in the community to traditional healers or to spiritual support if the individual would like that. And they're also trained to provide brief interventions that were developed specifically within the White Mountain Apache community. And they do lots of community outreach, community education. They're just so inspiring and really an amazing group.
And you noted the elders resilience curriculum, right? Where community elders go into the schools to talk to adolescents ages 11 to 14, I think you said. And it's really to talk about those Apache cultural values, traditions, and teachings as one of these approaches to reduce suicide among youth. Can you tell me a little bit more about how this intervention, which I just think is amazing given the multi-generational aspect of it, how was that developed?
Sure, that's a great question. As I mentioned, the White Mountain Apache tribe and our Center for American Indian Health have had this long partnership working on lots of health issues and suicide prevention since the early 1990s. And one thing that I didn't mention earlier is that tribal elders have always guided this work. Tribal elders are our cultural keepers, our wisdom keepers. They're well respected within Native communities. So it's really important that they were guiding the work within the tribal community. And they were the ones that actually had the initial idea for a program like this. This emerged from discussions among tribal elders within the White Mountain Apache community. And it really came from a group of about 30 to 50 elders who form an elders council within the community. And many of the elders emphasized how important it is for youth to learn Apache identity, to learn their language, to learn their culture and their traditions, to prevent suicide. They thought this is the way that we're going to prevent suicide within the community, and this is what they wanted to do for the youth. So the age group that we target within the curriculum is middle schoolers, 11 to 14, and that's very intentional because what we know from the suicide surveillance data is that the highest risk group for suicide within the White Mountain Apache community is 15 to 24. So elders wanted to reach kids before they hit that higher risk period from 15 to 24. Also, middle school is a developmental time when peer influences are very strong. So we thought, if these lessons are in the classrooms and youth are learning this together, it could really have a positive impact among youth within the community. So the program started very informally. The elders started to go into classrooms and start teaching youth. They also took youth on field trips that were facilitated by the Celebrating Life team to visit sacred lands and to have youth learn directly from elders about things like traditional plants and traditional medicines out in the community. And after doing that informal curriculum for about 4 to 5 years, the Elders Council said they wanted to ensure that youth were learning consistent content across the schools. So the Celebrating Life team and the elders and our Center for American Indian Health helped with the formal development of the curriculum as we know it today, which was a long process. It took 4.5 years for the curriculum to be developed. And that was done with a lot of really in-depth interviewing work with elders to really learn from them what life used to be like, what they thought youth needed to learn, and what topics and content should be included in the curriculum. The elders and Celebrating Life staff met many times to review, and it was really an iterative process to discuss and decide on the final content that the elders would teach in classrooms every single month. So the final content has monthly main topics. They're all different topics. However, one of the main themes that emerged from the elders was the importance of respect. So that's an overarching theme that you see throughout the curriculum that they're teaching. And then each month there is a specific topic. And they also teach youth Apache words in the curriculum. And sometimes if they have time, they're able to tell stories.
That sounds like it would just be something kids would be glued to hear elders speak, in the classroom environment with your peers. How do the youth respond to the elders in the elders resilience curriculum? And I guess, how do the elders respond to the youth? I imagine there's a unique relationship there.
Absolutely. As you saw in the video, the elders have said they're motivated and really inspired to teach Apache language and culture to youth in the community. Anecdotally, we've also heard from the Celebrating Life staff that local teachers have shared that after the elders come into the classrooms and teach lessons, they notice visible changes in the students being more respectful to one another, showing less problems within their behavior. And the teachers really think that the elders have a calming effect on the students. We've also heard really heartwarming stories of youth seeing the elders out in the community, say, for example, at the grocery store, and they get really excited and go talk to them. So this is truly having a positive impact within the community. And we'll be doing some upcoming research in the near future to hear directly from youth about their perspectives from participating in the Elders Resilience curriculum.
So, having that input directly from the participants, those youth, is going to be, I imagine, something you're very excited for. But how else are you monitoring whether or not the elders curriculum is working and specifically working for that intended stated purpose of reducing suicide?
Yeah, that's a great question. So going back to talking about the suicide surveillance system that is embedded within the community, that allows us to have real-time data about suicidal behavior, suicide ideation across the community. So recently, the White Mountain Apache tribe and Johns Hopkins partners have compared Celebrating Life surveillance data and have seen a significant decrease in both suicide attempts and deaths across the community during a 5-year time period to another 5-year time period after the surveillance and case management and community education And community-wide interventions like the elders curriculum have been implemented and saw that decrease. Now, that's really significant if you look at suicide data from the US, because suicide rates have gradually increased. So while the White Mountain Apache community was seeing decreases, the rest of the United States was seeing an increase in suicide rates. So that's really amazing.
Absolutely, with comparison to the fuller population, but isn't there also just like this sense of both relief, but also just wow, when you see, especially after all of this work to develop the curriculum in partnership, and you see it's working. I mean, what kind of impact does that have on the community?
Absolutely. I think it has a true impact, and it's really the only community-based surveillance system focused on suicide within the world that we know of. And this is such an amazing model that so many people can learn from. And again, I think it goes back to similar to what Melissa said, is caring for the community and caring for one another and protecting the community and connectedness to the community. I think those are important values that we can see day in and day out by the amazing Celebrating Life team and the work that they're doing.
And caring for the community took on another role with you and your team during COVID, right? So you and your team did play this role during the COVID epidemic in the US, specifically targeting resilience building in youth. And you developed a children's book, Our Smallest Warriors, Our Strongest Medicine. Who had the idea to write this book?
Yeah, so my colleague, Dr. Emily Harose, who's also at our Center for American Indian Health, had seen a book early in the pandemic last year, and it's called My Hero Is You, How Kids Can Fight COVID-19. And this was a book that was developed by the Interagency Standing Committee Reference Group on Mental Health and Psychosocial Support in Emergency Settings to help families and children around the world understand and cope with the COVID-19 pandemic. So that original book was created with input from caregivers and teachers and experts in 104 different countries. And when we saw it, we thought, we wonder if we can adapt this book to represent Indigenous peoples' values and communities' experiences in coping with the COVID-19 pandemic. So we convened a virtual collaborative team of 14 child development, mental health, public health, and health communications experts to help us rewrite the story. And we had an amazing Indigenous youth artist, Joelle Joyner, who created all of the beautiful illustrations that you see in the book. So the final book that we created weaves together public health information about COVID-19. It provides mental health coping tools for parents and children. And it also weaves really important shared cultural values that families and many tribes can relate to. We distributed the book for free online through our center's website, and we also sent out print copies through a partnership with Indian Health Service, through our center's tribal partnerships, as well as an early childhood home visiting program called Family Spirit. And we also provided books online. Organizations and tribes could request bulk orders on a first-come, first-served basis. And we were really amazed by the response. We distributed more than 42,000 books, and they've reached children and families from 105 tribes in the United States, 12 First Nations in Canada, more than 50 urban and intertribal organizations throughout the country, more than 100 tribal and Indian Health Service clinics and departments, as well as schools, libraries, education-based organizations. It just really took on a life of its own, and we were so happy to see it being spread throughout the country.
That's amazing that this book was obviously something that people wanted to read. They wanted to read it with their children. I mean, it's phenomenal. And Chelsea Clinton recognized this. She tweeted about this book, Our Smallest Warriors, Our Strongest Medicine. And she has 2.9 million followers on Twitter. So tell me about that tweet and what it was like to have that book mentioned on a platform with 2.9 million followers. And you have this distribution of 40,000 copies that just fly out and reach people and meet this demand. Like what does that feel like?
It's amazing. We're so grateful that Chelsea Clinton reached out to our team and she wanted to have a meeting and learn more about the book and shared a tweet about Our Smallest Warriors, Our Strongest Medicine. And Chelsea is a public health advocate and she herself is a children's book writer. So she's truly an incredible ally to Indigenous communities for using her platform to spread the word about this book. And we're still amazed and appreciative because we know that by her doing that, this helps increase the book's reach even more to children and families.
Are any follow-up plans? Is there a follow-up book in the works?
Yes, we are actually in the process of developing a sequel and we're just finishing it up right now. Because of the positive feedback and the high demand, our sequel is titled Our Smallest Warriors, Our Strongest Medicine, Honoring Our Teachings During COVID-19. So we convened the same team who helped us write and illustrate the original book. We met on Zoom, had several virtual meetings, and our work group helped come up with this theme of honoring our tribal teachings during the pandemic and carrying them forward with us beyond the pandemic. And the sequel follows the same characters, but it focuses on adjustments to education that children have experienced over the past year. Things like modifications to celebrations and gatherings during the pandemic, the vaccine distribution, which tribes have been leading the way, and it's amazing to see across the country, and other topics that align with the new and changing public health guidance around the pandemic. So we're very excited. The sequel will be published in the next few weeks.
So Victoria, just to wrap up our conversation here, same question as I asked Melissa. Why do you do the work that you do?
I'm really inspired and motivated by my tribal values around taking care of one another and fellowship and taking care of community. I'm also extremely inspired by the strong Indigenous women in my family, especially my mom and my late grandma. My late grandma was actually a community health worker for our tribe, and she took so much pride in serving our people. So you can say public health has always been a part of my life, and it's been passed to me through my family.
Well, I just want to thank you both, Melissa and Victoria, for being with us today from the Center for American Indian Health at the Johns Hopkins Bloomberg School of Public Health. And we are so happy you also agreed to take a few questions from the audience. Again, audience, please feel free to send them in on the platform. If we don't get to your question in the next few minutes, we will post it on Twitter when this session goes live to the Johns Hopkins YouTube channel. First question for Melissa and Victoria. What kind of federal funding helps to support this work, and how important is such funding?
Oh, so the Healing Pathways Study, 100% supported by federal funds, specifically the National Institutes of Health. It would not exist without it. It's the kind of research that needs that kind of support, hefty budget support. Talk about it, it's 8 communities spanning 20 years. It's everything for us. And most of the work I do is actually funded by the National Institutes of Health. So federal funding is the core of the research we do.
And Victoria?
Yeah, the Elders Resilience Curriculum has been funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA, through their Garrett Lee Smith Youth Suicide Prevention Grants, which have been so important to continue the Elders curriculum work. We also have a current grant with the National Institute of Mental Health, which is so important, and that's related to what I talked about with the upcoming work with getting youth perspectives directly. That's part of that work. And Our Smallest Warriors, Our Strongest Medicine has had some private funders, but a really important federal funder was the Indian Health Service, which both helped us with getting the book out to clinics and distributing tens of thousands of storybooks. So we could not have had the reach of that storybook without the support of the Indian Health Service.
Fantastic. Melissa, Kit asks, where can we find a copy of the BCE tool you mentioned? Is it free to use?
Absolutely free. Everything we do, we share. So Kit can either contact me or the measure should be published in the next few months. Fingers crossed, we're on a final revise and resubmit with the journal. But feel free to find me on the Hopkins webpage, send me an email. We are very happy to share. You can also find the original measure. I mentioned Angela Narayan, Naryayan, to find her version of the measure.
This one is for you, Victoria. Inspiring presentation. Can you recommend any publications describing the community-centered model outlined today, or perhaps even more description of how the White Mountain Apache surveillance system and case management system for suicide and the resilience curriculum from the elders? How is there any kind of resource that shows how all of this fits together?
Absolutely. We have several publications, including in the American Journal of Public Health, as well as a few other journals talking about the surveillance system and how impactful it's been in the community and how it was developed. We also have a different paper on the outcome data that I mentioned showing decreases in suicide attempts and deaths. So we have a separate paper on that. We also have a process paper that really dives into how the Elders Resilience curriculum was developed. And I'm happy to share any of that information with anyone who would like to contact me.
And Melissa, do you have a paper describing the healing pathways process for community-centered research?
We do. We have a couple of papers and chapters for multiple projects, including healing pathways, including a manuscript with collaborator at Hopkins, Allison Barlow, who's our director, about how we do this whole community-driven measurement adaptation process. And I would say this, if people are interested in healing pathways, you can Google healing pathways, JHU, and we have a webpage, and there is links to all of our publications, the YouTube channel, article, infographics, things like that you can find online.
And you know what, when this session goes live to the Hopkins YouTube channel, what we'll do when we tweet about this is we will be sure to include those links so that people can use that resource as well from both Melissa and Victoria. Carrie asks, is there much discussion between communities on best practices, or are most interventions very community specific? Melissa, do you want to take that one?
Sure. This is a huge scientific question, right? Generalizability versus specificity. Even within the same cultural group, every community is different. This is true for all cultures, not just Native folks, right? So we have this conversation all the time. And what I am witnessing just even in the past few years is much more Native communities building ground up interventions or prevention programs and sharing them with one another and doing some cultural adaptations. It feels a little easier than going from like a Eurocentric model and then trying to adapt that for the cultural context. And what as an aside to this, but related, Family Spirit, a program Victoria mentioned that our center has been heavily involved in, is being used in non-Native communities. So I think the core active ingredients of these programs are things we really discuss as scientists and community members, and then how can we share that with basic adaptation lessons so other communities can benefit too.
Fantastic. And Victoria, kind of following up on that, a question from Aminata. Do you have plans to expand programs to other tribes? I'm a citizen of the Chickasaw Nation in Oklahoma.
That's definitely the hope, and I think goal long term. I'm really interested in seeing if we can scale programs like the Elders Resilience curriculum to other tribal communities. And just as Melissa had said, you know, it's really amazing to see how one tribe can create a really impactful program like the Elders Resilience curriculum, and what can we learn from the active ingredients and the core components of that program, and how can we then make that available to other communities who make it culturally specific to their tribe or community. So that's truly the hope with our programs within the mental health team.
So a question about NIH. Have you seen changes at NIH, the National Institutes of Health, that are growing more supportive of CBPR and Indigenous ground up research?
Oh, I can take that one. Yes, and there's still so much room to grow. Two things. One is I was part of a 4-author panel for the National Institutes of Health, where we produced a report that's up on the tribal, it's called the Throw webpage on NIH, where it's really tips to consider for reviewers of American Indian Alaska Native health research. And one of the key lessons was, or key take-home messages was, CBPR, community-based participatory research, or community co-creation defined by the community in whatever way that works. And what I think is super cool is not just in tribal context is this, I mean, this is a standard, but this kind of process is necessary in all of public health and all research, because we are grappling as a nation, as a world, with mistrust of science, mistrust of scientists. These processes break down those barriers. That's why they exist. So two messages there. There are changes. I think there's codified stuff happening at NIH. I think reviewers are starting to learn this in their curriculums at public health schools, including ours. And we still have room to grow.
And last question for Victoria. Melissa noted this North Star of health equity. How is research and Indigenous communities informing public health approaches to promote equity more broadly?
That's a great question. I think Indigenous communities have so much to teach the world about public health. And if you look at some of the core values that Melissa and I have mentioned, like connectedness across community, connectedness to lands and the environment. Can you imagine if everyone across the globe lived by similar values and looked out for one another and looked out to protect each other and the entire community instead of just oneself, and protecting the environment, what our world would look like? So the world certainly has so much to learn from Indigenous communities.
Absolutely. I can't thank you both enough for taking the time to teach us today about community-based participatory research with these excellent examples, explain how this all functions together, and share your personal motivation as well as your excitement and the engagement with the community that drives this research. Thank you so much for being with us today.
Thank you so much, Wado.
Thank you so much.
And next Wednesday, we'll be talking with Brian Garibaldi, the medical director of the Johns Hopkins Medicine Biocontainment Unit, the BCU. We will go inside the BCU. We will learn about the role that this team is playing in the COVID pandemic and how they are already preparing for the next possible pandemic. So thanks for tuning in, and we'll see you next week. Be well and bye for now.